Excellent. Good evening, everyone. We are live here with Dr. Kishan Rees from What Media, and of course myself, doctor turned hypnotist Aaron Calvert. Good evening, Dr. Kishan. How are you?
Hello, evening. How you doing? There's a very soothing voice for a hypnotist, might I add.
Well, it kind of goes with the job, really, if I'm honest.
Mellifluous was a word that I learnt yesterday, which is honey-like sounding from the Latin melly.
Fair play. That's quite educational for this time on a sort of Saturday evening,
It-
if I'm honest.
Sorry, it's pretty hardcore, isn't it? But I'm learning my words again well. I didn't not that I knew that word before, to be fair, but following my head injury, I've got to learn my words again.
Wonderful. Well, we've had the first technical glitch, if I'm correcting thing, because I think there was no sound on the beginning there, which is a little
Oh
bit
no,
annoying.
that's a
But
shame.
I fixed it now.
Okay, so we'll start again. Can I give it a go introducing them?
You can do it, and no one will ever
Okay,
know
cool.
that I.
Okay, cool. So, hello everybody, and welcome to this special live stream in terms of we're broadcasting to around 50,000 subscribers across 6 channels. That's Prepare for FI1, What Media, the Prescription Podcast, and also is it Ribble FM as well? Aaron, is it going on that page? I don't know whether Aaron can hear me.
Yeah, I
And
can hear
I
you.
wonder if Tracy, can you hear me? I can see you put. Oh, cool. Okay, so yeah. So
Fantastic.
I've
We'll
done my little
go.
go
We're
introducing.
on
I
it.
think we've got all the technical gremlins out of the system. Yeah, let's do it.
Fantastic. Thank you very much for joining us. Obviously, we're broadcasting out over a number of channels. Potentially, there's over 50,000 people watching now. Thank you to the Facebook algorithms. Probably only about 1% or 0.01% of those people actually see this stream. So please do like, share, and let people know that it's live. We're going to be covering all things kind of COVID related. We're going to be covering all sorts of health topics as well. Your support and you sharing it, hopefully, the information that we're going to be giving out is a good source of information as opposed to some of maybe the scientific briefings we've had going on so far. So please do share this about and let people know you're watching. If you do have any questions, please pop a question in the comment box and we'll do our best to get to them as well. So yeah, fantastic. So
Brilliant. Sounds good.
where shall we start? What are you feeling on a Saturday evening at 7 p.m.?
Well, I think the first thing is the I saw a great clip from Channel 4, which was about West Enders in terms of saying they're saying something like number 10 is bracing for some kind of coming stunt. And I just think, yeah, that's just what the country needs more political amateur dramatics to distract from what is vital public health messaging. So, I mean, between the two of us, we've both got a degree, one each. I hasten to add, we didn't share it to the audience, but um, I practice, and you don't practice, but you do different things in health and well-being. And
Absolutely.
I just think between us and the training that we've got, I think we should answer people's questions. So if any comments come in, we should answer those. But failing that, we should just talk about what people can do to stay healthy in what is an increasingly concerning time.
Yeah, and I think there's a lot of concern sort of going around right now. I think at the moment it's kind of a bit of a change from the first lockdown. Initially, there was that concern about we've never been in a situation like this before. Kishan, your camera's just flipped around as well for some reason, just so you're aware. But we've never been in a situation like this previous to the first lockdown, but because we've been through it once now, there's almost a flippancy that, oh, great, we're in lockdown, whatever, we'll sort of carry on. And because of that, then potentially we open ourselves up to the potential that actually we aren't going to look after ourselves as well as we maybe tried to in the first lockdown.
Well, I completely agree, but also I'm not sure. I'm not convinced that the majority of the population did look after themselves in the first lockdown. Because if you look at the numbers, there's a pent up tidal wave of, firstly, sadly, lots of people that actually lost their lives from preventable causes because they didn't seek medical attention,
Yeah,
whether that be a heart attack or a stroke or various other things that are eminently treatable. But then also, I don't think people realize just how severe it was and what an undertaking was being asked of us. to lock down for a period of 3 months, and what impact that has on health, happiness, and well-being, both from a physical and psychological perspective.
Yeah, absolutely. I think, when we all went into that initial lockdown, so for a bit of perspective from myself, I got married on the 6th of March, and my wife and I actually went on our honeymoon. So we were in Mauritius when all of this was kind of unfolding back home. And to be honest, we didn't really keep an eye on it, and kind of a little bit naive, really, because my wife at that point was 20 weeks pregnant. So we went onto a flight with a potentially infectious disease that has at that point we didn't know how it would affect pregnancy and pregnant women.
I mean,
Yeah,
we still don't really know, to be
no.
honest.
And we didn't really have any consideration for it. But, the stress of actually being out there was a bit of a unique situation, really. As funny as it sounds, although you're on honeymoon, you're supposed to be relaxing and unwinding. And we were making decisions like Elliot owns a salon, so we were having to make the decision to close the salon whilst we were abroad. I was getting inquiries in from clients worried that we're going to have to cancel kind of events in April and potentially May as well. And then part of the honeymoon, we were on to Dubai. That got cancelled, so we came home early. And we came back to basically this lockdown with more or less, not a lot on the shelves, if I'm honest, because they had been raided. And that added to a whole different level of stress for us, really.
I can imagine, and also, I mean, that's one thing that I would like to mention in terms of the way people were sort of teased in a very unkind way in terms of, for instance, people leaving supermarkets with shopping trolleys full of toilet roll, for instance, right?
Yeah.
So if you look at the psychology behind it, certainly if you are in certain socioeconomic groups where you might not have high levels of disposable income, there's actually some psychology behind it where you will actually buy something that's particularly large but also particularly low price, and toilet roll fits the bill. So I think a lot of the sort of avocado munching metropolitan elite people wanting to just take the piss, quite frankly, out of people that have no idea what they're going through. And I just think we should all, that yesterday was World Kindness Day, right? And I think this is going to be increasingly important over the next few months, because as the nights draw in, the weather's cold. If people thought lockdown in the summer was difficult,
Yeah.
you want to see what the next 3-4 months are going to be like. Because I tell you what, Aaron, my fear is they've locked down now hard, not because they're following any data, not because they're following the numbers, because if you look at the SAGE committee, they actually suggested that they should lock down 2-3 weeks before that. And Keir Starmer also called out for that and said that as well. But then what started to look like was happening is they were getting hurt in the polling because Christmas might be cancelled, which quite frankly, it's Diwali today, right?
Yeah.
For me, it's Diwali. And am I seeing my family? No. Do I want to? Yes, of course I do. But the polling was looking like if Christmas was cancelled, it would be bad for them.
Yeah.
So they lock down now. They open up on the 2nd of December. Apparently, as I mentioned on the Ribble FM little interview that we did, apparently, according to Boris Johnson, regardless of what the R rate is, they're going to open up regardless. It doesn't matter if it's rising or high or whatever. They're still going to open up on the 2nd of December. So I don't know. Maybe that was Dom. Maybe Dom's gone.
That's his bombshell.
Maybe the advice that Boris is getting now is better. So I don't know. We'll have to see what Carrie suggests.
Well, I think he's going up to a few different castles around the UK to do a polling and see whether there's any advice on whether he should open up or not. And I know we talked about it on the radio show, but it is a tough time. And if the R rate is going up, that's something that genuinely needs considering, because we don't want to end up for the next 6 months in lockdown again. I mean, if we look at places like Melbourne, for instance, Melbourne had a hard lockdown to start with, as most of Australia did. They raised things a bit quicker than we did, suddenly going from being able to go to see no one and hang out with no one. We went to 6. They went to, I think, it was either 12 or 18, I think, they were allowed to hang around in groups of, which is just insane. So there was a spate of house parties, and then their R rate raised pretty quickly, and then they ended up in lockdown. So they've only just come out of their second full lockdown. I think it was 119 days was their second full lockdown. And that's really what we want to avoid. Yeah. Sort of going forwards is having another
100%, 100%, 100%. Aaron, sorry to cut you off there. I completely agree. signal issues, because what I'd say was, if you look at New Zealand and you look at other countries that way, they went for zero COVID right from the beginning.
Yeah.
Whereas we can never let people forget that, regardless of the advice Boris Johnson got, we will never know what the advice he got was, and whether he listened to it or not, or whether he didn't get the advice. All we know is he went out on this morning, or yeah, it's this morning, isn't it? Not Good Morning. It's this morning. He doesn't appear on Good Morning Britain, but anyway. So he went on this morning with Holly and Phil and said, yeah, let's just take it on the chin and let it move through the population. And the World Health Organization are coming out saying that is morally irreprehensible to let a unknown pathogen sweep through the population where we don't know what's happening with it. And if you look at long COVID, where there's 600,000 plus people in the UK alone suffering severe, debilitating disease, many of whom have been young, fit, healthy afterwards.
Yeah.
That was a reckless and an irresponsible thing to do, in my humble opinion.
Yeah, I completely agree, and we've touched on this before. I think sort of the communication from top down, this whole thing was underestimated. I know that there has been a plan for a pandemic within government for a number of years. I don't think they ever have followed that plan. Because if they did, that plan seriously needs reviewing.
So I'll tell you what, the person that you want to interview about that is a doctor called Dr. Musa Qureshi, right? He's a hematologist, and he's actually ended up taking the government to court.
Wow.
When that started at the beginning, I was kind of like, oh God, here we go again, another judicial review. What's it going to do? But credit to them, they actually said that the court ruled, and I can't talk massively about this because I'm not across it, so it's better that you talk to Musa. But the court ruled that the government should be releasing the data, and they should be releasing the planning and the worst case scenarios. And there was something that came out in the media where Hunt said that he refused. He stopped playing. He stopped the war game. He stopped the exercise when he was asked to make the decision to switch off 4,000 ITU beds across the UK.
Wow.
And again, unfortunately, that was another distraction, and that was another... It's a real shame, because that plan was a plan for flu.
Yeah.
This obviously is not flu. This is very different. So yeah, that's a tip for a guest for you. If you want to get Musa Qureshi on your podcast, he will gladly, I would have thought, talk to you about it, because he's very knowledgeable about it, and I'm sure your listeners would find it incredibly interesting.
Yeah, we'll have to touch base with him as well. So we could probably go on and on about kind of, and we've talked in private about my view on kind of why I kind of left the NHS, as it were, and what I think at the moment the government is doing pre sort of pandemic in terms of putting a lot of the stress onto the individuals that work in the NHS as a way to essentially justify a privatisation. And we won't get in too much into that, whether you believe that or whether you think it's a conspiracy theory that I'm going on about. But, the
people... I think it's I think we should have discussion about it, right? And I think anybody who shuts down anything and says it's a conspiracy theory, I would suggest is quite narrow-minded.
Yeah. But yeah,
and I would suggest that why don't we just look at it? Because look at it this way: whether it's privatisation or not, which it is in many parts. But if you look at the Serco test and trace fiasco, and the amount of billions that have been spent on that, but we can't afford apparently to give kids in half-term food, and they're going hungry in. It takes a Premier League footballer, Marcus Rashford, to hold the government to account to actually make this happen, right? I just think it's inexcusable to waste billions on something that doesn't work. And the app, let's not forget that was a bit of a shambles as well.
Yep.
Not used to feed kids. So even beyond the getting into the privatization, the conspiracy theory, that realm of level of discussion, on the ground, you've got a clear, demonstrable example where taxpayers' money has been squandered.
Yep.
And you've also got a clear, demonstrable example where kids are going hungry, and it's taking a Premier League footballer to fix it.
And I think you've hit the nail on the head there, Kishan, because we should be holding the government responsible for their choices and their actions. That's the whole point of the government. That's the whole point of a democracy. And if we think that that how things have been handled is a shambles. That was a tough word to say there in that sort of sentence. That how things have been handled. I should have left it in the first time I said it. If we think it has been handled shambolically, there we go, that's a little easier,
Nice. Well done.
then we should be holding the government to account and changing the way. But, this is kind of a discussion between us on like health and happiness and well-being. So I really want to bring it back to that, because a lot of the media are obviously scaremongering about the facts, about the statistics, about all the different things that are going on right now. And I think it's really important that we are taking our advice from reputable sources and not just following the clickbait. Because let's face it, how long did they go on about Cummings and the castle? Like, because it was a good clickbait thing. Whereas actually what should have been communicated in that point was, how can you look after yourself? What can you be doing in lockdown to make the best of your physical condition, to make sure that if you do get COVID, that it's not, it isn't fatal for you. And that was never communicated. That wasn't ever talked about. It was just this sort of Cummins focus. And now with him leaving, my worry is at a time when we're sort of coming towards the end of a lockdown, which may or may not continue. Granted, the R numbers on the way up, so it maybe should continue through December and into the new year. My fear is that actually the media are just going to lean on the fact that Cummins has left number 10 and not actually give out good, healthy information.
I can completely agree. And I think you say about scaremongering. I'm not entirely sure that the media are, a lot of it, intentionally scaremongering, right? I think it's a combination of the fact that the communication from the top has been poor from the beginning, and then that's been cascaded and amplified via the various media outlets. And the one thing I could suggest, as you said, if you wanted to take it back to health and wellness and well-being, is just people switch off from it, right? You do not need to know every 2 minutes what the numbers are doing. You need to know once a day, maybe for 10, 15 minutes, what the news is in your area. You need to abide by the rules, do the hand space, get a test, and keep your distance, most importantly, because we have learned about this virus, right? We do know that if you spend a long time in a contained space with somebody internally with poor ventilation and you don't have a mask on, then highly likelihood is if one person in there is infected, a significant proportion of people in that room are going to get it, right? So that's the kind of level of communication that really needs to go out, and people really need to understand. Because somebody told me once a while ago, and they said that in the absence of information, humans just make stuff up. And I think by the poor communication going out there, it's left a lot of doubt in people's minds. And what it's done essentially has meant that people have been able to make up sort of anti-mask conspiracies, COVID conspiracies. And we know that social media is incredibly polarized, and the whole business model on it is 100% on clickbait and just get as many people into one of those two camps so that they can kind of argue with each other.
Yeah, and
which is not healthy.
The interesting thing is with social media as well is that not only is it to get you into one of those camps, but then it only starts to show you posts that actually solidify your belief, that prove that what you are thinking and what you believe is correct. They only show you posts that you are going to enjoy and interact with. And then obviously people go through and post things, and you happen across a post that is the polar opposite of your view, and that's how arguments get involved and chaos ensues. But it starts to solidify. So for instance, if you start looking at like mass conspiracies, for instance, it'll start to show you more conspiracies around the world, and before you know it, you start to happen upon the moon landing as a conspiracy, because Facebook now knows that you're into conspiracies. It knows that it isn't true that that wearing a mask decreases your oxygen saturation. It knows it's not true, but it doesn't matter because it's breeding a community, and that's what sort of Facebook and the other social media giants thrive upon, is that idea of community and communication. So let's touch on the mask element then. You're a doctor. I've been trained, and I've spent time in theatres, I've spent time with masks on, and I've spent the last, 8 months of my life wearing a mask pretty much every time I go outside. And I can honestly say my blood oxygen is absolutely fine.
Yeah, likewise. I mean, it's just a complete nonsense to suggest otherwise, right? And I don't think it's as bad as it is in the States over here. If you look at the people in the States, where they'll shoot somebody basically if they're wearing a mask or not, or either way.
Yeah.
So thank goodness for that. But anybody who says that they can't wear a mask unless they've got a medical exemption certificate, they're kidding themselves. And it's got to be up to us. I mean, I said this a while ago. What would really help is if people could for us to be able to challenge people in terms of say you really need to wear a mask, the people that have medical reasons not to wear it need to some kind of lanyard, some kind of badge, some kind of way of identifying themselves. And then there needs to be a mass public health campaign around the importance of masking up, and not just masking up, but being courteous to the fact that, if you've got somebody who's elderly carrying their shopping bags, it's probably their right of way, right? And just
Yeah.
get out of their way. Whereas, to be fair, right, to be positive, I think certainly the areas where I'm about in Watford, that's quite good, right? People are quite courteous. They are wearing their masks. They are keeping their distance. But I know that in other areas of the country, they're not. Like I had to drive through Leicester a few months ago, and it was just like Narborough Road was just basically like nothing had ever happened. There were loads of people coming in and out of shops. So some of the Asian areas in London, sort of Brent and Harrow, they've got numbers of cases. I think it's Brent is 600 per 100,000, which is significant.
Yeah.
And obviously, we're in Diwali, right? So for those Indian families that are meeting each other, I think they shouldn't. I think it's risky. And they should just, cancel Diwali, as far as I'm concerned, because you could do it via Zoom, and it's better to everybody to be happy, healthy, and safe, and enjoy the next Diwali rather than make this one your last potentially. Because some people might think that's scaremongering, but it's not. We really don't know what this does to which people.
Yeah.
All we do know is certain groups are high risk. So Asians, diabetics, certain health conditions like asthma, heart disease. If you were to contract this virus, your chances of positive outcome are significantly lowered.
Yeah, and I think that is the big problem. It's all well and good with everyone that comes back in with the sort of retort of, oh, well, flu kills more people per year. But it's not to do with the number of deaths there currently are. It's the potential for it to cause problems for other people. But within that vulnerable group, there's a higher significance of risk associated with death after catching COVID than there is with a standard flu. But also, we have no idea of what the long-term effects are. And I think a lot of people do kind of almost, because the symptoms can be mild in most people, then people kind of ignore it and go, oh, well, if I've got it, whatever. And then they just go about their day and then they spread it to someone else. But eventually it's going to come across someone that is vulnerable and is going to have issues. But even with mild symptoms, there has been now studies that have shown that people with mild symptoms have long-term effects that we didn't know about, 8 months ago, which is crazy to think about. So if you think that we're finding long-term effects now, we could potentially be finding a lot more long-term effects in the next 5 to 10 years. And that's what it's all
100%.
about. These restrictions are not just about making sure that you don't have a bit of a cough or a sniffle or whatever, or they're not about cancelling big holidays or locking us all down or any type of control over the population. They're actually about a proper public health concern. Because we could be seeing a lot more health conditions related to COVID in the future that's going to affect, the young population, the old population, and everyone equally. So we do need to, as much as possible, eradicate COVID as quickly as possible. And whatever way that happens, whether it is through lockdown, whether it is through vaccination, one thing's for sure, sort of herd immunity is not on the cards. That just isn't going to work because there is long-term effects from having been infected with COVID as an actual disease, as opposed to having a vaccine. Not to stir up the
100%.
anti-vaxxers,
I,
but
I couldn't agree more. But one thing I would say on that, right, in terms of, oh, sorry, I've forgotten. I shouldn't have cut you off. You said scaremongering. We talked about that.
yeah.
We talked. No, sorry, keep going. I lost it. Sorry.
That's all right. This is the joy of doing things live, isn't it? Because we don't want to go back and sort of edit our thoughts. These are genuinely our thoughts that are coming out, and our opinions and their reflection on people that we work with or for. These are our thoughts and beliefs, but coming from kind of.
I got it.
Great,
Sorry,
I filled
it's
enough
about,
time. That's it.
Thank you. That's good. Nice one. Thanks very much. So when you've got people like Nigel Farage coming out saying, at what point does the cure become worse than the disease, right? Last time I checked, he didn't have a medical degree, right? And the problem is we don't know. We honestly don't know the long-term effects of this. And we, as you quite rightly said, there are people who are maybe very mild symptoms or asymptomatic who then further down the line are getting long COVID. And that is not a nice disease. That is not a something that you want to test out, right? So my biggest suggestion for people is to modify their environment in as positive way as possible, right? So I know it's difficult. I know homes have been converted into offices overnight. But we live in a country where generally it's much better than some of the other countries that this disease is ravaging. So I think, putting stuff in perspective is helpful in terms of, we do have possibilities, and we do have options in the sense that, the whole society is not breaking down as it is in some countries around the world.
Yeah.
And then it's just a case of controlling what you can in your environment. For instance, I've got a standing desk, right? It sounds very grand. It's not. It's literally a shelf and some books, and then my laptop is on some reams of paper.
Behind the scenes,
and then yeah, behind the scenes, exactly. I mean, listen, everything at this kind of level is okay. You don't want to see what's on the floor, right? It's literally just papers, books, clothes, bags. But I don't mind because I live quite a fulfilling life. I enjoy my work. I exercise slowly now as I'm getting back to full fitness. And I know that's something that you wanted to talk about.
Mm-hmm.
So maybe if we move on to like the biohacking thing, because I think that is useful for people to take on board.
Yeah, so just before that, we've actually got a question come in. So someone was, obviously, they've said, that they're well up on the mask debate, and they do believe that people should be wearing masks, and they should. They do prevent the spread of disease. If you are wearing one and the person that you're passing is wearing one, if one of you sneezes, it's going to catch in one of your masks, and you're also going to reduce your chance of inhaling any of the virus as well. But they're actually asking about the wearing gloves debate, the idea of the constant use of gloves around kind of a shopping area or something like that, which obviously is still the same as transmitting the virus from surface to surface to surface. And then also it detracts from the idea of actually just washing and using alcohol gel frequently to make sure that you are trying to rid your hands of virus.
Okay, put it this way. There's so much to unpack there, and I think it's good. And I'd like to talk about foe might spread, Dr. Hillary, and the sort of general reflection, right? So I'll start in the middle with Dr. Hillary in terms of he took the view that, public shouldn't be wearing masks, shouldn't be wearing gloves, and even masks. I think there's a clip going around where he says, don't wear them because people might touch the mask or touch their mouth. And I was like, come on, let's not infantilize people. Let's educate them to teach them how to take the masks off, how to wear the gloves properly. And, really, really simple things. Blue on the outside, pinch it on your nose, bring it round so it makes a seal, and put the loops around your ears. When you take it off, just hold the end and throw it away. Yeah. That's it, right? That from a high level, whether it be governmental or media, I don't think it's that difficult. I've just done it in 5-6 seconds, and that's on my time, my money, right? So some of the big communication agencies that are getting contracted to do this, that we need to speak up. If they're getting taxpayers' money to do these campaigns, it's finally they landed on one, hands, face, space, which actually makes sense and is sensible, right?
Yeah.
So that's the first bit. The second bit is the predominant way that these spread, this virus spreads is via, as you rightly said, droplet infection, coughing, sneezing, as the World Health Organization puts it, poor respiratory etiquette.
Yeah.
Now, at the beginning of this, they were suggesting to people coughing into your elbow, which I think, well, how is that sensible, right? How is that a good idea? How is that good respiratory etiquette? Because then it's just potentially on your elbow, and then where's that going to go? Is that really a good idea? Surely catch it, bin it, kill it is a far better way. Cough, sneeze into tissues, catch it and bin it, right? But the gloves bit comes in terms of there's a concern that if somebody with a particularly high viral load sneezes or coughs all over something and touches it, and then you touch it and then put it in your mouth or your eyes, there's a potential route of transmission there, right?
Yeah.
So I tell you what, I went out today. I popped into the shop. I didn't have any gloves, but I made sure I went out with this. Other hand gel is available, but I like this one from Superdrug. It's not sponsored, but because it smells of strawberry and raspberry, right?
Yeah.
So
nice.
I've just made it. Thanks. Yeah, I'll send you some if you want.
Thank you.
But like I've basically made it in all of my coats. I've got, well, my main coat, I've got some leather gloves, which is useful. I've got masks and I've got alcohol gel, right?
Yeah.
Now, today, when I went out, I didn't use my gloves because I'm conscious and I'm mindful of what I'm touching. So, yes, I haven't got any cuts or anything on my hands. The skin forms a very good protective barrier for infection. So I picked up a basket. There's no risk of me picking up that basket as long as I thoroughly sanitize my hands afterwards with alcohol gel,
Yeah.
right? So that's what I did. Now, unfortunately, this comes back to education, where right at the beginning of this, I saw somebody standing outside the same shop that I was in today. They had a mask on and they put it on top of their head, and they had gloves on that had been wandering around doing various stuff with, eating with the gloves. Now, of course, that's crazy and that's not going to help matters, right? But again, we can't blame those people because we've gone through medical training. We've been taught how to use masks, gloves, etc., etc.
Yeah.
So we need that mass level public information campaign. And that is what is going to mitigate the impact of this, because it's infected 10% of the population, and we've racked up World War II levels of debt. So there's still 90% of the population left to infect potentially.
Yeah.
So we really need, maybe, who knows, Allegra Stratton doing the White House style briefings. Who knows?
Yeah.
I would have suggested it would have been better to get an independent doctor to do it. So, Boris, if you're watching and you want me to help out, I'll be more than happy to.
Yeah, I'll do the stream for him. I'll make sure the sound's on at the beginning though, so we'll be all right there. But so
yeah, exactly.
So interestingly, at Nottingham Med School, what you do is you do actually a BMed Sci degree in the middle of your medical degree, because they don't think you're busy enough as it is. But it does mean you come out with a separate degree and you have to do a dissertation. Now, mine was on infection control, specifically looking at hand hygiene. And even if we look at professionals, this is genuinely shocking. So one of the statistics is healthcare professionals working in hospitals. The national average of doctors and nurses and healthcare assistants washing their hands at the appropriate times when they're supposed to, doing it right every single time, is roughly about 49%. And that's people who have had the education. But, in everyday life, they're just kind of going through things day by day, and you get on that autopilot. I think that's something, as the population becomes educated on health and hygiene and hand hygiene, it's important for them to keep it at the forefront of their mind. I mean, if we go back to the beginning of this sort of pandemic, and I come back from Mauritius with the wife. She's 23 weeks pregnant by now. We come back to this very changed landscape because I didn't know the effects on pregnancy. I was the only one who went to the shops. I went to Tesco. There are other supermarkets available. Yeah. And I went to Tesco.
I was just going to say that.
I've got you. It's my BBC training kicking in that. So went to Tesco. And, when I came back, I was the only one that touched the bags. I got alcohol wipes. I wiped down every single item that I'd bought. It then went to its respective
very similar
cupboard.
to my house, yeah.
And then I stripped off completely down to the boxers, not quite to the nud. Put that straight in the wash, and then I went straight for a shower. That was kind of the cleansing ritual because, I have a 6-year-old in the house. I've got a pregnant wife. I had no idea what the impact on them would be. And so we took it incredibly seriously. Now, I'm not saying that, that's exactly how I shop now, because it isn't. But I still make sure that I've got alcohol gel. I still make sure that I've got gloves. I'm still going out of my way to make sure my hand hygiene is better than it's ever been in my entire life, just to limit that infection. So that risk of infection. And I may, when I come home, I may change my jumper before I hold my now 16-week-old son, because I don't want to
entirely
risk
sensible.
That. And some people may find that absolutely mental that that's what I do. But
no, well, some do, but I would agree in the sense that that's exactly what happened. And just to add to that, in terms of, I still do that now. We still do that now. And also, if anyone has to come to the house, i.e. for maintenance or do something like, I don't know, plumber, electrician or whatever, they get a temperature check at the door. Although we do know that if people are starting to show signs of temperature, it's already quite late in their disease course. But still, it's useful to whether to let them into your house or not. So temperature check at the door, assuming that's okay. Get them to alcohol sanitize their hands at the door. Get them to put a mask on, and then let them come in. And I wouldn't necessarily say that is unreasonable.
No, not at all. I think that's absolutely reasonable, and in fact, they should be doing those things as standard anyway. So that brings us nicely, I guess, onto what people can kind of do to help with their health and help with the outlook. Because from a sort of stress side of things, the biggest thing is people feel out of control. And you've already touched on it, the idea of controlling your bubble. So for me, going to Tesco, washing my hands, using alcohol gel around the shops, coming in, making sure I wash my hands thoroughly with antibacterial soap. I know it's a virus, but antibacterial soap will still be good because there are still other infections that are available. It isn't just limited to COVID.
That's that BBC training kicking in again,
that's
Aaron,
the one.
isn't it?
It's automatic now. I say anything and it comes out with that. But and then making sure that we are following those guidelines. But I'm protecting my bubble as much as I can. Now I do have a 6-year-old that goes to school, but when he comes home from school, he knows that he takes his uniform off, he washes his hands thoroughly. We again limit those risk factors, and by controlling that bubble, it's taken a lot of stress away of the if, buts, maybes that, I might get COVID. But there are other things that we can be doing that will help us as well. And I know you're big into it. You're big into the biohacking. So, what do you want to tell us a little bit more about that?
Sure, glad to. And just before I do, I've just seen a comment from Kaza Rudd Cohen, who says, I've had long COVID for 8 months and have never been so ill. Avoid if you can. You can be young and you can be extremely fit and still be disabled by long COVID, which can affect 1 in 5 people who get COVID. So that brings it into stark focus, right? In terms of, at the beginning of this, I realized how severe it was. I took exactly the same precautions that you did, and I started in a similar way to you do in terms of broadcasting to the people that you can and the people that you can reach.
Yeah.
So that in the hope that they tell other people, and actually it does what our taxpayer money should be being used for to do, right? But anyway, so at the beginning of this, I said I was 89 or 90 kilos, and I'm only 5'7", 5'8". I'm not particularly tall, so to be 89, 90 kilos is not particularly healthy, right?
No.
So I started cycling, and again, it was actually the ritual in terms of. So at the beginning of this, my sleep was disturbed. I didn't particularly want a family member to go to work because they have medical conditions, and I was, going to bed, pleading with them at night, saying, "Look, please don't go to work in the morning." To the point I was in tears, and it was only at that point where they actually stopped and listened and said, "Okay, fine, don't worry." Now, when the government letter came through 2.5 weeks later, saying actually you need to be shielded because you're incredibly vulnerable, the relief there was, it was that moment where, okay, right, fine, we do need to take this seriously.
Yeah.
But so I would not be surprised still now if people watching are having ups, having downs, having sleep that's disturbed, and anything that you can do to improve that, right? There's this great thing that I bought. I think it's still out and available. It's a National Geographic all about sleep.
Yeah.
Now, I sort of gravitated to this in Royal Tunbridge Wells Hospital, where I was admitted following my head injury 8 weeks ago or so ago, where I came off my bike, cracked my head open, and suffered a temporal lobe bleed about the size of a marble. So even then, my training that I've had as a doctor kicked in, that muscle memory, and I was looking what was in my environment as to what I could do to make myself better, right?
Yeah.
And so I went to the hospital. I looked around, I got the magazines, and I started reading more about sleep and learning more about how vital sleep is for immunity. And it's the time where your body heals and repairs. Now, if you exercise, your sleep is obviously going to get better. If you don't exercise and you don't sleep, you're going to get put on more weight. Your immunity is going to go down. Your anxiety levels are going to go through the roof. And as you said, it's not just COVID. There's so many other health issues that this can impact upon.
Yeah.
So yeah, I mean, for me at the beginning, biohacking was, I saw what was coming because I was watching what was happening around the world via social media, and I could see what was happening in other countries. And essentially, I took the view that, right, lockdown is going to be difficult, but it's spring. So it's salvageable and manageable. What do I do? So actually, I bought a Ribble bike.
Oh,
a Ribble
fantastic.
road
Thank
bike.
you for
So
supporting the local community. Yeah.
Yeah, no, 100%. Made in Lancashire, Ribble bike since 1892 or something.
Look at that.
Beautifully made, lovingly handcrafted. Got delivered on the day that I was going to cycle into London during lockdown on a mountain bike. But maybe the gremlins in either Royal Mail or Ribble heard, and they sent the bike to me on the day that I needed it. Brilliant.
Yeah.
Yeah, it also survived when I came off the hill and broke some ribs, got a lot of road rash, and hit my head repeatedly going down said hill. So
That's
yeah,
Lancashire
only
building for you. That's the quality that you get up here.
exactly the quality of Ribble bikes. And you know what? This isn't sponsored by Ribble, but I think if they want to put some behind it in terms of, we will talk so much about my Ribble bike and where I got it from. If they help us reach more people with this.
I mean, as a new dad, I mean, I'm definitely suffering from that lack of sleep and definitely a decrease in exercise. So by all means, send over a bike. I'll get out on it, Ribble. We're looking for any kind of.
See, no, I wasn't asking for a bike, right? I was just asking, can they do some abs?
No, I
But yeah.
was. I mean, I live down the road, and I definitely need to do more exercise.
To be fair, right, if we're getting into the realms where they're sending out bikes, right, I was thinking for my 35th birthday next year, I was going to buy quite a nice Ribble bike because, again, this is a biohacking thing, right? In your mid 30s, you will build you will have the highest levels of testosterone. Therefore, the muscle that you build during that time, you can maintain that muscle stock throughout the rest of your life.
Amazing.
Easier. And that's certainly like, so these, right? I've got these and it's taken me 4 weeks. So these are 10 kilos right by my desk. So on some of the more difficult meetings, the camera goes off. I'm still listening, I hasten to add.
Yeah.
But I may be found just doing some weights, just get the blood flowing again.
Mm-hmm.
And to give you an example of, right, how successful the biohacking was, on Friday, the 11th of September, I cycled 145 kilometers and I had no DOMS at all.
Wow.
That's not Dominic Cummings, you'll be pleased to know. That's delayed onset muscle soreness.
Yeah.
So no DOMS, 145 kilometers, 8.5 hours, went down to, I don't know, Hastings.
Insane.
No, I don't know, somewhere, right? Then I had Saturday, Sunday off and I was just chilling out, mooching about, reading the papers, trying not to cause too much trouble. And then on Monday, the 14th of September, it was 30 degrees. So I thought, right, I'm going to form a cycling club, the last of the summer wine cycling club, because it was probably the last day of the summer.
Yeah.
And unfortunately, at 131 kilometers, that's where I came off. But still, I did, so over a 2-day period with 2 days in between, I did 270 kilometers cycling.
Incredible.
And it's taken 8 weeks for me to be able to lift 20 kilos above my head again. So I'm really lucky that I'd got myself into good shape. I thought that it was to protect against COVID, but it can be against loads of other things as well.
Yeah.
And my neurologist has said to me, the only reason that you are making such a good recovery is because you're in such good shape at the beginning. And that is a lesson that I think anybody who watches this, whether it be a medical student, nursing student, member of the public, some of your clients, whoever watches this, everybody can improve their health and fitness that little bit. And it's a cumulative thing. It's that theory of marginal gains. A little improvement every day over a year will add up to almost exponential performance increase.
Yeah, and I think that's really important. That's a very good takeaway message from this conversation, is that the theory behind biohacking is basically looking at your body and how you can improve your fitness, your health, your well-being, all in one. So whether that's looking at your sleep and how you can improve your sleep, because as you said, sleep is a key recovery point. So it helps you recover from stress, it helps your body to heal, and generally makes you feel better, which obviously means that you can get out and have the motivation to do exercise, which will obviously start to increase your muscles and also improve your immunity as well. So all of these things together, it's looking at what you can do in your life, as small as they may be, making small changes each week to make yourself healthier. And by being healthier, if you do end up catching COVID, or you do end up coming and falling off your bike, or you happen to come down with another health condition, the chances of you recovering are vastly improved by the fact that you're in a better health position. So I think, although right now all we're focused on is that idea of not catching COVID or washing our hands or being COVID sensible, I think there's still greater health greater health problems at large, and we need to be taking care of ourselves to consider those as well and not overlook them.
I completely agree, Aaron. And you came up with a great phrase in terms of COVID sensible, right? Because this term COVID secure is also quite misleading and quite, I don't think it's very good, really, because if you, it's COVID compliant with legislation. But, viruses aren't going to just walk up to a building, look at the sign on the door and say, okay, it's COVID secure, I'm not going to go in, right? It doesn't work like that. So you can never be COVID secure. You can only be COVID compliant, as you said, COVID safe as much as possible.
Yeah.
And I think people should understand that. I get that, the school of political messaging, which the thick of it is funny for a very good reason, right? In the sense that um, I'm just getting flashbacks of when they're sitting around in circle time on the thick of it and like whatever, all that sort of stuff. I won't go down that, but the thick of it is rings true because we need to start treating the public with the respect that they deserve in terms of giving them the information, giving them the knowledge, and not just reducing something to a three-word slogan.
Yeah.
Because this is way too complicated. We've had Get Brexit done. We've had Take Back Control, fund the NHS on a big red bus.
Yeah.
We've had all this sort of stuff. Let's just have some sensible, proper communication where we are educating people so that they can make sensible, informed decisions. And that's what I hope over this year, because I think I hate to break it to people watching, but 2021 I think is going to be much of the same.
Yeah.
And I hope that we can make a bit of an impact by, growing this channel, growing your channel, having these kind of chats. And as we do more of them, maybe we could do a regular thing, and then people can send their questions in, and then they can go and tell their friends and colleagues about it. Because unfortunately, you're not going to. I do buy all the papers, and I look at them, and I read them, and I look at it, but I don't see anything in the mainstream media that's helping people.
No, and I put out some mental health videos, obviously coming from kind of the point of view of being kind of a hypnotist and hypnotherapist, from a doctor. I've got a lot of focus on the kind of mental health, and I put out a lot of videos and free content on how to help yourself de-stress and get back on top of kind of anxiety, which obviously during lockdown is going to spike. And we have had another question come in, and we'll come to that in a few moments' time. But I think, education is the key, and I think that's the key at every step of the way. And from my point of view, the NHS is kind of at a breaking point because it was never designed to be functioning for, a 66 million big population who go when they've got so much as a sniffle. If anything, lockdowns kind of held people from overusing the service, but education is what's going to help the NHS survive, when you should use the service and when you shouldn't use the service, and which departments to use as well. But the trouble is, I don't think any government will ever invest in that as a long-term educational plan, because...
Sorry, what did you say? What did you say is going to help it survive? I missed that word.
Education. So education is going to help the NHS survive by educating the population on how to use the service and when to use the service. You shouldn't be going in if your child's just got a runny nose, because the chances are it's just a cold.
You know what? I'll cut you off there. I'll say one thing actually, which I think I've said a while before. It's really important. Is the Royal College of Emergency Medicine and physicians, Royal College of Emergency Medicine physicians have said that they don't believe that a child's parents, or anybody for that matter, at a point of crisis in their health should be making a decision about to which service to seek. Mm-hmm. It is up to government and service people that are organising services to co-locate A&E, pharmacy, out-of-hours GP, and put the appropriate systems and flows in place so that if somebody is coming and seeking help at a time of crisis, it's not a case of getting a flea in your ear, as Jane Secker once said to me on an interview about this very topic, and being sent away, because that is a failure of planning, right? That is a failure of the highest order and the highest level. And I've worked in departments where all those services are co-located, and the level of care that is offered in those environments is far surpasses anything else where it's separately located, right? So that's my only kind of little comment I would say there. And I just think we need to speak truth to power and hold it to account in terms of saying, look, we are all paying for this. We are all paying our national insurance. This is our NHS, and we need to be consulted in terms of what kind of NHS we would like.
Yeah, absolutely. I couldn't agree more. So I'm going to save the last question for literally the last question. So before we get to there, I think it's probably a good time to start the wrap up. If people want to find out more information about you and more information about kind of the biohacking stuff you've done, and just get some good general information from yourself, what are the best channels and ways to find that from yourself?
So it's not your typical answer for this, in the sense that I pop up when I feel that there's something relevant to say, right? So I don't just put out content every single day.
Yeah.
I think people can look back on the WhatMed Facebook page where everything going back 6 years is there, or the YouTube page where again everything's been archived. I occasionally look in on Twitter at Dr. Kishan Rees, but that's almost as bad as my emails. I wouldn't suggest trying to reach out to me on that because I don't read it all.
Yeah.
And it's serious, right? My personal phone, I've turned off every single notification: Facebook, email, WhatsApp, everything. I've trained myself to get into a point where A, it helps me be efficient, but B, it helps protect against the bad things that social media does to you. So yeah, I mean, I keep an eye out on WhatMed channels, whether it be Facebook or YouTube. Obviously, there's Prepare for FY1, which is more of a targeted at a medical student level and that kind of audience. And yeah, just sorry, it's not the best answer because I genuinely believe that these channels are not the be all and end all, and it's just been a bit of a hobby for me, right? I don't get paid for it. I just do it because I think it's a public service, really.
Yeah, absolutely. So essentially why I put out the free videos on stress earlier in the year. So if you do want to find out about stress, if you are suffering from any of the symptoms of stress or you're worried that your anxiety is going through the roof, you can find a load of free videos and information on prescriptionhypnosis.com under the Beat Stress tab. Obviously, you and I caught up on Ribble FM on Monday. So each Monday at 1 till 2, you can listen to Ribble FM 106.7 either via your smart speaker, via the app, or live on the radio with a health and wellbeing hour once a week on a Monday, and then I follow up with an extended chat with the guest each week, like yourself, on a podcast called the Prescription Podcast. A little bit of a nod to the Dr. Past, but hopefully we're going to do this a little bit more regularly. It looks like we've got a fan as well in Nikki Scorer. I hope I pronounced your surname right there. She's thinking it should be a regular thing, so happy days. But this is the last question that's come in actually from Lee, who runs Ribble FM, and he's a voice of the valley, you might say. He said, do you think we should go into a proper lockdown like we had in March? What are your thoughts on that?
I think it depends on how people take it, right? And I think what we need is we need everybody, whether we're in lockdown or not, until the numbers go down. People need to understand what the disease is. They need to understand how it's reported. This is a big ask. Don't get me wrong. I'm not suggesting this is easy.
No.
But people really need to take it upon themselves to. Knowledge is power, right? Knowledge is power. And if you learn about COVID-19 and how it's transmitted and what the effects can be and how you can protect yourself from it, it should not be down to Whitehall deciding, right, we're going to lock down, right, we're not going to lock down. Because we all know that as soon as this lockdown ends on the 2nd of December, it's going to be crazy. Everyone's going to go out, spend money for Christmas, because again, they're balancing health and the economy, which in my mind is a false comparison, because if you have a public health crisis, the economy pales into insignificance, but that's a separate topic. Maybe we should do that for the next podcast.
Sounds good.
Everybody's going to go out, right, and shop, and then they're going to have Christmas because there's a lack of political leadership, in my humble opinion, from Boris, in the sense that he's not able to articulate to the population that actually Christmas is going to have to be different this year. They could have. It's about now, right? It's like Love Actually, 6 weeks to Christmas. Now is the time, Boris, if you're watching this, to start coming out and getting that public health messaging out there, so that families around the UK don't put their loved ones at risk as soon as you undo lockdown on the 2nd. People forget over the next 2 to 3 weeks, and then they have Christmas. So I don't think we should go into in answer to Lee's question, to go into a full lockdown like we did before, because the full lockdown went in because there was absolutely no public health messaging or communication at the top.
Yeah.
And it was, we had to stop, we had to hold, we had to do something so that the NHS didn't get overrun. Because you look at various countries around the world where unfortunately you saw bodies piling up in hospitals. We can never have that situation. So it's completely the right decision to do then. It's again, the numbers are going up, so it's the right decision to do now.
Yeah.
But it's more of an impassioned plea to the population that you need to take it upon yourselves to take this seriously. It's not going anywhere anytime soon. And to be honest, nor are you, in the sense that if you look at the aviation industry, they're saying they're not going to get back to normal, whatever that will be, until 2024, right?
Yeah.
Now, I'm not saying that COVID is going to be around until 2024, I hope, touch wood. But like I said, 2021 is going to be difficult, and we can't be trapped in this perpetual cycle of government saying, right, lockdown, unlock down, lockdown, unlock down. because it's really disruptive and people's health will suffer if we do that.
Yeah, we definitely need more of a long-term solution than just in and out of lockdown. I think WHO came out to say actually going into a full lockdown is not advisable. That is not the way to be dealing with this as a public health crisis.
Yeah, and I saw that as well. You're right. I saw that because they said the knock-on effects on schooling, on mental health, on domestic violence, on alcohol misuse, drug abuse, various other things. It is a, I was going to say a sledgehammer to crack a nut, but that analogy doesn't work because it suggests that the COVID-19 problem is in kind of significant, which it's not.
Yeah.
But it is definitely a sledgehammer approach, which is only to be used if absolutely necessary.
I agree.
And members of the public need to upskill themselves and upskill themselves fast in order to protect themselves and their loved ones. And this isn't even an altruistic thing, right? This is a case of we don't know enough about the disease. If you get it, it is a bit of a Russian roulette as to how you're going to respond to it for many. As you quite rightly said, the study saying people are getting long COVID just with a very mild illness for a very short period of time.
Yeah.
But thanks. I hope that answers Lee's question.
Yeah, I think that's a really good point. And I think that's probably a great place to end as well. So thank you so much for your time. I realise that we're broadcasting on both our channels, so I'll thank myself as well. Thanks for my time as well, Aaron.
Couldn't have done it without you. I tell you what, you wrap up your bit. You got 30 seconds and then I'll do mine.
Wonderful. So yeah, thank you to everyone who's listening on the Prescription Podcast. Obviously, this is a live broadcast, but some people will be catching up on the podcast as well. You can find out more information on prescriptionhypnosis.com and of course the Facebook page for Prescription Hypnosis. You can tune in weekly at 1 till 2 on Ribble FM for the Health and Wellbeing Show.
Cool. And I'll just say thank you, Aaron, right? I don't have as a slick BBC radio trained presenter. The only thing that I'd suggest people to do is Google or YouTube why an ethical social media broadcaster was born. That is What Med Media. And you will see my run-in with Hull's Jeremy Paxman, Peter Levy on BBC Look North. And so that's the only BBC training that I had. It was more of a baptism of fire.
It was.
I did also go into BBC Nottingham local radio once, and I got told, don't look at the camera because people think you'll have a mental health problem. And I have that on footage. It's out in the public domain. So that's me. So thank you so much, Aaron, and I look forward to catching up next time.
Brilliant. Well, I've just got a note. Boris isn't watching, but Dominic Cummings is. Sadly, he's no longer employed, so he can't make an impact or take any of our advice forwards to the government. What a shame. But yeah, thank you very much, Dr. Kishan. And yeah, we'll catch up soon.
That's all. Cheers, mate.